Trauma is something that we are encountering more frequently than before, and there aren't as many supports that are out there in the community for some of these families. My name is Brianne and I am one of the infant mental health program supervisors at Starfish, and I also supervise our preschool behavioral health consultants that do our kind of collaborative work with our Head Start sites. One of the things that I really enjoyed is that it wasn't only a training that we offered for the teachers, but there were teachers, clinical staff, administrative staff there that were all getting the same information, and there is a lot of language within Trauma Smart, such as the brain is a car metaphor, that is really helpful information to be able to use with one another. There are some teachers and some site leaders that have really grasped onto that language, and they use it in meetings, they use it to with one another. I know that there is one site where the site leader has kind of put up the brain as a car model and has her staff, when they come in the morning, they each have a clip that has their name on it, and they can put where they are in the car. And that helps her to know where her staff are starting out in the day and if there's some additional support that the teachers might need in order to be more regulated so they can be calm and the best teachers that they can for the children. So it's a really nice way to speak in a non-threatening way about things that might be going on for us that might be impacting the work and our ability to be as successful as we would want to be during the day. Another thing that was really helpful was kind of thinking of things through a trauma lens or the concept of universal precautions. So we want to be planning for the classroom, for the policies that we have, for events that we have, in a way that is going to be supportive to the children, to the families, and to one another. We know that children and families have resiliency, but they also need some support sometimes in being able to access those resilience skills and to get back on track. And for young kids who experience trauma, it can throw their developmental trajectory off course, and they will need some support to get back on track so they are able to go to school where it's expected, to be able to use executive functioning skills, and to be regulated and to stay in a seat and follow directions all day.